3, 2, 1.
Hello, welcome to the April 13, 2020 meeting of the Stillwater City Council. This is a special council meeting, and I will call this meeting to order at this point. We only have 2 items on the agenda. First thing we'll go to, item 3A on the agenda, is discussion of potential impact to fiscal year 19 and 20 and fiscal year 2021 budgets due to the COVID-19 pandemic. We'll have Mr. McNichol, I guess, or we'll just jump right to Melissa Reams.
Good evening, Mayor and Council. You would bear with me for just one moment while I make a few opening comments, and then we have Melissa and Christy standing by. We join our retailers and other service people who are closed during this pandemic in suffering monetary loss. And at this point, staff has taken some what we believe to be fairly drastic steps to cut expenses. Christy and Melissa will tell you about that. And we will also tell you that because of the way our funds are collected and distributed, that it could be months before we know the true loss in revenue that we have suffered. There are just so many variables involved, both in electric and in sales tax, as those are our major revenue sources, that it is almost impossible to make a prediction. And we've watched some other city councils that have discussed their budget situation, and that message has been the same message that's been delivered at those other meetings. So I will let Melissa and Christy tell you what we have done, what we have looked at, and kind of somewhat of a map for the future.
Well, that's a large charge, Norman, map for the future right now, as everything is very up in the air. Melissa Reams, I'm the Deputy City Manager and Chief Financial Officer. And we started out, the Vice Mayor asked us a very probing question, I thought, when we were thinking about reductions and responses to this challenge to our economy. And she wanted to know what other towns, what our sister cities were doing here in Oklahoma, given that we are the only nation or the only state in the nation that only receives sales tax for operations. So as challenged as we feel as a community, can you imagine some of our very small sister cities and how daunting this economic climate is going to be for them to recover from? We watched the Norman City Council meeting. They had a special meeting last Tuesday night, and their budget director, Anthony Francisco, presented a budget prepared for them before COVID really hit the newspaper and before we started issuing our emergency declarations, which is much like what Christy and her team have done for us. And they presented that to you, gave you a preview back in February, and then we had the study session on the 23rd of March. Norman is going to proceed with their budget the way they have it constructed at this point in time, because, and you're going to hear this as a reoccurring theme, at this point, it's really too early to tell how deeply this is going to affect cities. So that's Norman. Tulsa, similar, they did, this came out of a Tulsa World article on March the 23rd. So I think the mayor had issued 2 emergency declarations kind of at that point in time. And this was after Tulsa would have closed down their bars and restaurants. And their finance director came in and said that he anticipates a 13% decrease in sales tax revenue just from those closed entities, so bars, restaurants, and entertainment venues. They have implemented a hiring freeze in Tulsa. And interestingly, they really felt like, as bad as this is, the downturn in the oil and gas market is probably going to impact them more than COVID. They're worried about both of those. Owasso, again, was quoted in the local paper, and their city manager seems to feel, and kudos to them if they're in this position, that their financial position is very strong and their reserves are adequate to make it through this economic downturn. Yukon has been discussing a 2% budget cut immediately. Oklahoma City has not so much done things to reduce their budget, but they're trying to do things to help the local businesses. They passed a small business incentive program for the COVID emergency, and they've waived the competitive bidding process for any type of preparedness equipment for the COVID response. I visited with my colleague over in Mustang, Tim Rooney. He's the city manager over there. They're doing very much what Stillwater and Norman are doing. They're going to approve the budget as it stands, and then we will amend the budget as we have better data as to how COVID is going to affect us. So that's kind of the economic climate of sister cities. I talked to the tax commission, my sales tax colleague there, and I had asked him what those economists were saying. The tax commission economists are kind of taking a wait and see attitude because I think it's a little early for them to make any kind of predictions as well. Interestingly, Mr. McClenny found an article from the Brookings Institute, and I'm glad to put the link out on the website, but it combined the two factors that they think will impact cities the most and the fastest is when you're reliant on what they call an elastic revenue, something like a sales tax revenue that expands and contracts with the economy, and a population that is more vulnerable to they're not the essential type service industries. So if you look at some of our industries here in Stillwater, we've seen downturns in their production. And I think some of them have actually stopped production. So that reactive nature with that elastic sales tax it sets us up to feel these impacts very quickly. And just the fact that in the state of Oklahoma, we do not have the ability, without a vote of the people, to access ad valorem tax or property tax for operations. So that's kind of where nationwide and focusing more down onto our sister cities, where we see we're right there in the mix. And in some regards, we're a little ahead of where some of our sister cities are with reacting to the COVID pandemic. Christy found a very good resource out on the Government Finance Officers Association website, and it's called Cash is King. And we'll put the link to that out on our website. But it talks about how do you as local government overcome one of these economic downturns. And it can be from any type of act of God. It could be, we feel very sorry for the folks in Louisiana after last night and the tornadoes and all of that. It can be anything like that causes you to suffer financially from the outcome of that. But Cash is King, and it talks about focusing on six areas where you can go and kind of tighten up and see if you can't make it through the financial crisis that you're facing. So personnel, capital spending. They recommend you look at your materials and your contractor costs. Again, you start looking at either reducing the outflows or increasing the inflows. And hopefully those inflows are new sources. Grants is the first thing that comes to mind, federal stimulus, those kinds of things. And then the last one was get new resources, which I think is more along the lines of the grants. These last two were kind of similar. So Christy and I started studying that. And one of the first things the document suggests is that you select out of your large leadership team, you select a more concentrated leadership team. So we didn't do this officially, but this is kind of who we started pulling to help us gain either information or insight into how we're going to proceed. So Norman McNichol, city manager, myself, Paula Dennison, assistant city manager, Christy Looper, HR director, Christy Cluck, finance director, Monty Carnes, city engineering director, Sherry Fletcher, marketing and civic engagement, Rob Hill, emergency management, and Brad Stewart, information technology. And they've kind of divided themselves up naturally into groups. Looper and Dennison have been working on our personnel. And they started out with, how do we protect our staff while still delivering good quality core services? And that's when they came up with the alternating work week. Paula and I have been alternating now for 4 weeks. So this week I'm in the office, Paula's at home. Last week we were flip-flopped. That way you always have someone who's coming off of 7 days of isolation to pick up the ball and roll if somebody either becomes ill or can't come into the office. And that's been working very effectively. In some of our crews, they're alternating every 3 weeks. So a new crew comes on every week for 3 weeks, and then they start the rotation over again. And they have found that very, very effective. In fact, they think they're going to carry some of this over when we are back to whatever normal looks like when we recover from this. So that's been interesting to watch. But first and foremost for Christy and Paula was the safety of our employees, the safety of our citizens by following or exceeding the CDC guidelines. And they've done a really good job of that. As we started working from home, if we didn't realize it just initially, it became very clear quickly that communication is key when you're working from home. And so we have started having weekly department head meetings via Zoom. And we have encouraged those departments to meet with their people frequently via Zoom. This has worked out as a platform very well for us. A lot just trying to disseminate information. Norman's been excellent at sending out all employee staff emails and getting the information out there so the stories don't get created because of the void created by no information. So we've really tried to keep people informed. We're looking at every open position request on a case-by-case basis. So we're really trying to decide, do we need this person? Can we postpone this? Can we defer this? We're really trying to be intentional about how we proceed. Again, Paula and Christy have looked at ratios. They've looked at how do we deploy staff. And there have been times where we've had to reduce service levels. A good example is in waste management, trying to avoid that contact. We're not picking up the blue bags right now. And so we're asking everybody to take the blue bags to the convenience collection center. And Paula has told me this afternoon that very good response. No one has really pushed back on that. So that's good to hear. So that's kind of where we are with personnel. And if you all have questions as we're going through it, please don't hesitate to stop and ask. So from a finance perspective, it is Christy and myself and Rob Hill, because Rob is really plugged into FEMA, and FEMA is going to be one of those new inflows, those new sources of revenue, if you will. Any of the measures that we're going to talk about this evening they're going to apply equally across the board to not only the city of Stillwater as an entity, but to the Stillwater Utilities Authority and to the Stillwater Economic Development Authority. So this is across, looking at us as a total organization and not just our legal entities. It's across the board. The first place we started was reviewing our purchasing card program. We have been very decentralized in this area for quite some time. In purchasing as a whole, we've been decentralized. And we've used purchasing cards to make payments and to allow people to buy the goods and services they needed. When you're decentralized like that, not intentionally, but it can lead to over purchasing. And people have begun to look at that P card as a way to avoid the proper procurement process in some instances. So we're tightening the throttle, if you will, on the purchasing card. Each department will have at least one purchasing card, and their limits are between $5,000 and $10,000. We are going to require that they do a requisition and a purchase order for every purchase that they make, and we have not required that in the past. But this way, you've got a gatekeeper, it happens to be me right now, looking at the POs that are coming through. And again, being very intentional about what we do with the money that's been entrusted to us. What else are we doing? We're tracking our direct related COVID expenditures, because from what Rob is telling us, those expenditures are potentially reimbursable at 75%. So we'll have 25% in the game. FEMA's going to reimburse us 75%. Christy has set up a project code for that. We're tracking preparedness expenditures, any overtime. If it's just during their workday, that's not going to count. It has to be overtime. And
Melissa,
go ahead.
Sorry.
Yes, ma'am.
As we talk about, what would those COVID expenses be, just for the general public to know? And is that what you're talking about? Is it any overtime that staff need to do?
Right. Preparedness. How do we prepare for COVID? It could be buying the masks if you can find them. Rob bought some visors the other day that are the full spectrum visor for some of our first responding staff. The overtime would be maybe more first responders. And then any kind of equipment that we need, maybe cleaning equipment. Maybe we've had to buy the wipes and all of that good stuff. So Rob is really plugged in. He's helping guiding us as to what's going to qualify and what's not. All of our advertising, Sherry was asking this question the other day, if the advertising we bought, if the public service announcements and all of that on the radio would count. And Rob felt very strongly that would. So we're going to include a lot of that in with our reimbursement request. He's already laid the groundwork for us. He's filed the request for public assistance. And Mayor, I believe you signed the state and local agreement the other day. So that lays the groundwork for us. The door's open. Now we just have to track our expenditures and submit them as we can. And I think they're still trying to figure out how this is all, FEMA and state emergency management, how this is all going to work. From a budget standpoint, we pulled Monty Carnes in and had him as the city's chief engineer or director of engineering, get with every department. So he's looking at electric, water, waste management, any of the departments that have construction contracts. Monty has sat down with those department heads and they're reviewing those contracts so that they can bring forward to you a plan. What Monty sees coming down the pipeline for us, as far as, again, another alternate revenue stream, is a transportation stimulus or capital infrastructure type stimulus dollars coming from the federal government. Generally, those have to be shovel ready projects. And I think some projects are more lend themselves better to federal type funding than other projects do. So that's why Monty is going through the projects with all the department heads. Number one, to say, we think this one would be super, or they would really like this for stimulus money, but it needs to be shovel ready. How far do we need to get it? Do we get it through design? Do we get it through design and engineering in the stop? How far do we get it? He's going to be bringing back that proposal to you. A couple of examples. We have the two bridges, the 3rd Street Bridge and the Husband Street Bridge. still working on moving that forward, getting the right of way, but we're hoping the timing's all going to play out because he thinks those bridge projects would be perfect for any kind of federal stimulus that might come our way. We have eliminated, or we're in the process of eliminating, any kind of non-essential expenditures. So examples, of course, the first one, and if you work in the private sector, you work in the public sector, what's the first thing people eliminate? Travel, because it's optional and you can clamp down on that. We're looking at reducing training. Now that one can be tricky because you want to maintain the professional staff's training. They need that to retain their credentials. And that's part of why you have them on staff, is for their credentials. But it also, those types of trainings can be the nucleus for some very inventive ideas of how to survive a downturn like this. So we're being strategic again about the training. And then there are some trainings that we just absolutely have to have, like our CLEAT training and our fire safety training. So we're being strategic with training. We're trying to make sure that our overtime is monitored, and if there is any way for us to comp that time, we do. So like Teresa will probably comp the time this evening during the rest of her work week. So we do that trade-off so we don't have to necessarily pay the overtime. So again, that's a managerial task that can be daunting sometimes, especially when you've got big work groups. Office supplies, I really think that if push came to shove, our organization has plenty of paper clips and Post-it notes and probably the little correcting tape. I think that we can survive with what we have right now. So we're really, again, pulling in on office supplies. And anything that begins with miscellaneous. I just really hate those categories. That's my own pet peeve. And I thank Gary Franklin for that, because he really taught me that in the very beginning of my career. But we're looking at miscellaneous really hard because that is just too easy to dump money into that. So that's some of what we're working on there. We've also asked our, again, Vice Mayor, thank you for this suggestion. We asked our department heads to go back and look at fiscal 21 and to prepare a budget based on a 25% reduction and one based on a 40% reduction. I think this will really help us. We're trying to, as we're watching revenues, we're trying to assess maybe where that breaking point is, if you will. And so we're thinking that these two jumping off points are going to be there. For some departments, this is a struggle. Because their budgets are so lean anyway, or they're very personnel heavy. And so to try and cut 25% is a challenge when you're trying to stay away from the personnel, but you're cutting these, sometimes they're the object codes that help them do their jobs. And so that's going to be a challenge for some of our departments, but we'll be working through that. So then I started looking at revenue, which it's hard to do right now because of the lag time there is between the time the transaction happens and the time we actually receive the money. So the sales tax money that we received last week was from February transactions that were reported to the tax commission in March. So at the end of February, we still were okay. Nothing was locked down. I think, Mayor, the first emergency declaration, I want to say, went out either the 15th or 16th of March. So we hadn't started to lock anything down at that point. And comparing to last year, we had an extra day because it was a leap year. However, our sales tax for February, on February sales, totaled $2.3 million, which is up $436,000 and change over the February the year before. Now, again, we had an extra day in there. And I don't think the 29th was a Sunday. I want to say that was a Saturday, maybe. And we're over budget a skosh, 527,000 and change, which is all great news. I think that's just wonderful. We need between the last 2 months of the year, and this is cash basis now, we need $4.2 million to satisfy our budget. And our budget totaled for 28,400. 28 million, sorry, 400,000. So we're doing really good. We just know that this black cloud is out there, and how is it going to affect us? So just me trying to play with the numbers, I went out and got the granular data for the January 2020 sales. And I didn't so much look at each individual remittance, but I looked at their industry code. I call it the NAICS code. It's the North American Industry Classification System. And it's a code based on what you sell, what product you sell, what service you sell. So I started sorting them into there's 24 of these high level categories, and I started sorting them into their high level categories. And then I looked at the top of our top 6 categories. The top 6 categories total $2.1 million. If we lose 50% of that revenue each month, we're losing $1 million times 12. That's how Norman's getting to the 12 million that he's saying is the bottom figure. Is 50% the right number? I don't know. It could be different for could be different for restaurants and bars. It could be a lot higher than that. And it could be lower for the grocery stores and the big box stores that are competing. But just tried to look at how that might impact us. And bear in mind that anything that the big pot of sales tax suffers is also going to suffer the penny, or it's going to reduce the penny that gets transferred to SUA for electric sales, and it's going to reduce the half penny that goes to pavement management. So it's a cumulative effect that we have to keep in mind. Use tax was good again this month, 235, almost 236,000. It's up 465,000 from the same month last year, and it's over budget. And this includes the budget amendment. And Christy, I can't remember when you took that budget amendment. I want to say it was March timeframe where we increased use tax.
It was March 23rd.
Okay. So Christy and you guys approved this, approved the budget, moved it up to 2.5 million. Currently we're over budget as we do per month, 304,000 on use tax. And to get to budget of 2.5 million, we really only need about 185,000 between May and June. So looking strong through the end of 2020. Again, that depends on how March turns out, and then it would be April collections. Lauren has gone in and looked at utility electric usage, because we're wondering how, when you have these big industrial customers that either have quit production or cut back on their production, what does that look like to the electric utility? Because you're thinking people are at home more, they probably have the lights on more, but is that a one-to-one? It's not a one-to-one shift. I just couldn't think that it is. So he went in and looked at the days. Norman, you may have to help me explain this, but he went in and kind of looked at the weather conditions that we had during the last 2 weeks of March, and he tried to find those same weather conditions last year in that same time frame in March, and he's tried to extrapolate what he thinks the downturn is, and what he's come up with is about 23% drop in electric usage. So again, it has those ripple effects. We get, Christy, correct me if I'm wrong, but I think we get a 2% sales tax on electric sales, do we not?
Yes, some part of our electric sales are subject to sales tax, not 100% of them. Yeah.
Right. So as the usage drops, the sales tax comes down. Again, it affects the dedicated pieces. It's kind of this rolling effect. It'll affect the transfer. The less electricity we sell, of course, you have a reduction in the electricity that we purchase, but it's still going to could affect the transfer into the general fund. It's just these constant ripples going on. We are investigating, looking at these new sources of revenue now that we've seen kind of what we think. And please don't hang your hat on any of those numbers. Those numbers are so soft, and but they're going to give you a flavor for what could happen. We are looking at what is available to us through federal stimulus. And if you've been following any of this, I know Norman's been watching everything that comes out. Very little is available to cities our size, not directly. It's usually these big metroplexes that are going to get the money first. And then they're going to entrust states to come in and allocate to the smaller cities. Norman, unless you've heard something different, I don't know that we know how that allocation is going to proceed, do we?
Well, our best guess at this point is that those funds will come in some form of a CDBG-like project where the money is granted, hopefully at 100%. But there is nothing. We've spent a great deal of time tonight talking about replacement of revenue, and there is nothing in any of the federal packages yet that would replace revenue for smaller cities. Cities over, well, at this point, it appears as though any county that has over a half million people are going to get the lion's share of the $1.25 billion that has been allocated to each state. And anything that's left after those larger counties receive that money will be parsed out to municipalities by their percentage of the population. And again, it's totally unknown how the state will handle that. Evidently, our congressional representatives have some say in that. And I know that we have sent messages that what we really need, although the project-based things like the bridges that Melissa talked about would be nice, what we really need at this point is revenue replacement. And there is talk in Congress right now about that. And hopefully they'll come up with another package. One thing that Melissa mentioned that I want to make clear, Oklahoma City was in the enviable position of having passed an economic development bond issue. And that incentive money that Melissa was talking about is the proceeds of that bond, not coming directly out of OKC's general fund or other ordinary revenue. And we don't have one of those to be able to help. So with those clarifications, we see nothing that is revenue replacement in any of the federal packages.
And Norman's been in contact with our state senator and our representatives, both at the state level and the federal level, trying to plead our case, if you will, because again, Oklahoma is unique. We are the only ones that cities don't share in property tax. One source we are looking at, and thanks to Councilor Jaloski for leading the way on this one, is grants. And we have put out a request for a proposal, and we'll be interviewing 2 candidates this week that are companies that help identify grants that could be a good match for the city, and then they are going to help us apply for that grant. Now, do they always win the grant? No, they don't. I think the one I remember had like an 85% success rate, but that's better than us not trying at all. And they are, the way they are paid is kind of a fixed fee with a commission if you do win the grant. So we're going to be looking at that this week. We think that while that's money that we have to spend, we think that could pay big for us on the backside. Some other areas that I would urge you all to be thinking about as we move through this is transfers. And it's not necessarily the one we think about is from the SUA over to the general fund. And I want you to be thinking about the fact that those monies could be greatly reduced depending on how utility sales go in the electric utility and in waste management. You do have the ability to come in and make some decisions as trustees in that area. And some of that would be documented through resolution. And John, you can correct me if I'm off base here. There was a resolution done that created these self-contained water and wastewater funds. Christy and I feel like you could come back in as trustees, and in this particular instance, you could lift that restriction, if you will, or designation. And at this point in time, if there were available funds, you could move that to the general fund if needed. The transfer that we make every year into the electric rate stabilization fund, and it's been budgeted, I think, $4 million again this next year. That really, from our research, that's not even in resolution. So you do that through approval of the budget, but you could come back in and say, no, we need the help over here. So again, we would urge you to do that by a resolution probably, and get that, you could put that money where you needed it the most. And finally, reserves. And we've talked a lot about reserves. Christy's done yeoman's work on these reserves. And they are there. There's like savings accounts that any of us have in our personal lives. And they are there for uses in times like this. But I would encourage us not to jump to that one right out of the gate. Let's see if we can't tighten the throttle and pull things in and see if we can't make this work and get us a little further down the road. One of our big concerns is that we would have another natural disaster, just like our happened in Louisiana last night. I think they said there were 63 tornadoes last night on the weather. So if we had another big hit on top of this economic downturn, we would really need to go to those reserves at that point. So really, you're right. We've talked about reserves. They are there for acts of God, such as this one. But let's see if we can't take some less invasive measures right now, and let's preserve those savings, if at all possible, in the short run, because we may need it in the long run, depending on how long this goes. So that's kind of finance, and it's the heart of what we're doing right now. Kudos to Brad Stewart and Sherry Fletcher and their team. It is so wonderful to be able to have this Zoom meeting and have everybody on the call. It's very clear, it's understandable, and that's in large part due to our technology staff. So kudos to them. And then Sherry and Rob and Norman have, again, done such a great job of communicating not only with staff, but with our citizens, so that our citizens know what their government is doing, and that we are leading. The mayor's leading, you as counselors are leading, you're setting policy, and Norman and staff as city staff are leading the charge here. So how do we proceed? And Christy and I were having this conversation last week, and one of the first questions we talked about is, how long do you think this recovery period will be? Christy kind of had it broken down for us into a short-term or shorter recovery period, middle recovery period, and a longer recovery period. So the short term was 12 to 18 months. The middle period was less than 5 years, and the longer was greater than 5 years. And not that we have a crystal ball for that, but we felt like a conservative approach might be to look at this as a middle of the road, less than 5-year recovery period. So then we posed the question to each other, what factors indicate recovery? Because we will never ever go back to where we were on February 29th. We won't go back to where we were even on March the 14th before the declaration started. So what does recovery look like? And I would venture to guess that part of it will be that we start lifting the declarations and people start going back to work, going back to their businesses. Businesses will reopen. There will be those that reopen, but then there will be those that don't survive and don't reopen. And the time it takes for new businesses to backfill those that didn't reopen. I think events will start again, like graduation and weddings and family reunions, to where you don't have to do it long distance. You can actually be in the same room with each other. And I think sales tax may never come back to where it was. We didn't ever go back to where Stillwater was in 2014 before the oil and gas market took a drop. But we will reach some degree of stability again. And that's what we've seen over the last few years is we've reached this level of stability. So be thinking about, what does recovery look like to you? And then what factors affect that recovery? And I've said this for a long time, and I think you all agree. One of our big economic engines is Oklahoma State University. That whole organization generates a lot of sales tax for the city of Stillwater. So if and when and how the college comes back will be very interesting. If video learning takes a big upswing and we don't need brick and mortar, we don't need to come to the classroom, that could have a long lasting effect and maybe make that recovery extend even further. Will the events come back? The arts festival, the graduations, athletics, the conferences, homecoming, walk around. I mean, you can just create a very long list of things that we're already missing. And how do those come back? How many residents leave Stillwater? Let's say if the college doesn't come back in its form that it was, and you have more online learning, I can be an instructor in Colorado teaching for Oklahoma State University. I don't necessarily have to live here in Stillwater. So how does that look to us? Did the census turn out the way we wanted it to? We sure hope that it does, but yet to be seen. And how much of the federal stimulus will cities like Stillwater receive? And so finally, the last question I think we all need to be pondering is, what are we doing as a city and as an organization to adapt? And Paula told me I wasn't supposed to use new normal anymore. To our reality, the way we see it now. How do we adapt to that? It's here, so what are we going to do? From an organization, again, we're looking for those efficiencies. And I know that I have been talking about this for a very long time, but now that it's very real to us, that we understand why we need the efficiencies, I think we're looking even harder than we had been. We're rethinking a lot of our procedures, and to hear we've always done it that way is just not cutting it anymore. We are looking at how do we be a tighter, more responsible organization. From a community, I love what I'm seeing coming out of these hard times. The partnerships that are developing, the pop-up grocery stores. I think the article was in it was either the Friday, I think it was the Friday paper, wasn't it? Where they talked about the pop-up grocery stores at Aspen Coffee out in Fountain Square and downtown. Those types of collaborations are really going to see us through this, and helping the small business take take advantage of the stimulus programs that are available to them.
We provided you with a whole lot of financial information in your packet this week, and it was online. If you have any questions about that, I think Christy can answer it. There's one item that we have not talked about tonight, and that is personnel. A lot of our expenses are made up of personnel, but those are also the people that provide services to our citizens. And we have discovered in the last week that, or not last week, in the last year, it seems like, since the middle of March, that those folks are very, very important to this organization. And we would like to not take any action in that area, as, again, they are the ones that provide the help to our citizens. So that is an option that we can look at in the future, but it is our view at this point, try to avoid that. I would, Melissa, talk to you about reserves. I'm pleased to tell you that if the article that I read about the city of Tulsa is correct, that Stillwater has a reserve fund that even eclipses Tulsa's. That does not mean that we jump in and spend it. That was a very hard fought, long time in coming, meeting the council's view of what our reserve should be. And although we could certainly, if our estimates are correct and lost revenue, we can certainly jump in there and just act like nothing ever happened. That would not be prudent from a management standpoint. So we're scouring everything that we can find in terms of a way to find data. The fact of the matter is that there just isn't sufficient data right now to give you any definitive information. It was interesting, and kudos to all of our department heads. I'm kind of surprised that we didn't have some illnesses over some of the things that we've asked them to do, because I'm sure they're wondering where this ship is going because of what we've asked them to do, the cutback on purchasing, the cutback on purchasing cards, the change in purchasing procedures, asking someone where the budget is heavily weighted in personnel to come up with both a 25 and 40% reduction in budget. All of those things, I am sure, are quite worrisome to them. They're well aware that we don't have the data to make any predictions. And I really tell you, you have a really good staff here that bite their tongues and do what they're asked to do, and they do it in a good manner. But the variables in all of this, you could almost fill out a whole page of the variables that affect all of this that we've talked about here tonight. In the 3 weeks of data that Lauren Smith had to present, temperature plays a huge role. So a 10-degree swing or a 15-degree swing in temperature can make a big difference on the amount of electricity that's used. So right now, as we've told you, as with other cities, we're just kind of in a wait and see situation until we can get our hands on some hard data. So if there are questions on any of the financial items that we provided you, Christy and Melissa would stand by to help to answer those questions. One of the things that we will bring to you next week is a list of, and this is another thing that's difficult to swallow. Melissa and I spent a couple of years coming up with, and others, in coming up with funding to do some pretty significant capital improvements. We're going to bring you a list of those next week that we think we should put on hold until we determine exactly what's going on with revenue in the city, once again, because of the danger in spending down those reserves. So you have a lot of information on that. As Melissa said, Monty has been around to all of the departments and has shovel-ready projects. There are a lot of them that stand ready to go. And those we will certainly ask you to put on hold until we determine exactly what our share of any federal distribution of infrastructure funds may be, and what Congress may do in the next few weeks in terms of additional incentives. So thanks to the entire team again for their difficult work in this situation.
Yeah, absolutely. Thanks, Melissa and Norman, for kind of the updates and the info and the questions and all of that insight at this point. I wanted to chime in real quick before I ask the council for other questions, but I think this issue has raised, as you guys both spoke about, the fact that the city of Stillwater, like all cities in the state, depend on sales tax revenues for general operations. Unless that city has asked its citizens and those citizens have voted to fund certain things out of general obligation bonds, out of ad valorem revenue, property tax revenue. I would point out that the city of Oklahoma City currently runs 16 mills of property tax on it within the city of Oklahoma City, and it funds things like, I think, just over $500 million in street improvement. I talked to Mayor Holt a while back, and he said that none of their sales tax money gets spent on street improvement. All of that comes out of their ad valorem GO bonds. You also mentioned the $5.5 million fund that they've set up for business assistance. That all comes out of GO bonds. So there is an option. We do, as a city, have the option to try to find different ways to fund our city government. We haven't done that in the past. I think this is a time at which we're going to have to start looking much more closely at how we can diversify our revenue as a city, so that a gigantic hit to sales tax revenue does not produce the kind of economic effects we're going to see from this event, and instead, evens out our income so that we're in a little bit better position. Because I think those cities, Oklahoma City and Tulsa, that do both have a significant amount of bonding to help manage these things, are going to be in a better position to recover because they're not so dependent on sales tax like we are. So just a statement at this point on that end. Councilors, any other questions or comments from Melissa or Norman on the financial situation?
One other thing that we have done, Mayor, is we're talking to our representatives about the fact that municipalities do not have access to ad valorem for operations. And I want to make sure that people out there understand the difference. A capital project is something that you can fund with a GO bond, but it has to be very specifically named when you do it. That is not operations like paying employees to fix water lines or sewer lines or that kind of thing. So there is a difference. And again, Oklahoma is the only state in the United States that where that stands true. So I am confident in talking to some of our sister cities that there will be a lot of pressure on the legislature to take a look at that.
Councilors, anything further?
I just wanted to say thank you so much to the city staff. I think in a time like this, having this baseline information helps us make better decisions moving forward. And I know it's not a new normal, but we certainly have a future normal to think about. And I think without some of that baseline information to make decisions and prioritize, and it would just be so much harder. And I really appreciate the work that had gone into the budget already at this point, and the work that you're doing to establish some of those baselines in the departments, so that certainly we trust you to make those decisions at the department level. But it's nice to know that you guys are looking at that baseline information and just having some of that data in place as we move forward. And I also hope I'm excited about the opportunity to look at different grant opportunities. Obviously, like the mayor said, those bond issues would fund a lot more, but maybe some of that grant and incentive money can offset some of the costs that we normally would have spent on capital projects. My experience in the past, when we went through the last economic downturn, that money that came through often came through without matching fund requirements and things like that. So those was a little bit of a relief to communities when that money came through. So hopefully we'll see some of that same thing. And I think it goes across the board. Hopefully our nonprofits around the community are also looking at ways that they can support our community with different funding, and then also ways that they can boost their own funding. I think grants across the board will be something that communities will have to look at, and our community partners will also have to look at as well. So thank you for that work.
Yeah, I had one other issue that I was going to talk about, and now I forgot what it was.
Mary, if you don't mind, while you're
Go
thinking, Councilor Jaloski just jogged my memory that we should have mentioned it. We're going to meet with our P3s and suggest that they start fundraising. We don't know where we're going to be. We don't know what our ability is going to be to continue funding all of those at the level that they're funded. And I think that they need to have a clear picture of, as we know it, at least today, a clear picture of what the future may hold.
Okay. And by P3s, you're referring to public-private partnerships, the
Yeah, yes, sir.
private groups that help us manage things like parks and sports,
Recreation,
and the lake, and all those kinds of things.
Right.
Yeah. Okay. So, Melissa, this was what I was gonna ask you about. So our fiscal year runs through June, but the fiscal year refers to when we actually collect those taxes, right? So it's the sales taxes collected through April that show up in the budget.
True. We do some accruals at the end of the year so that when the sale happens is really reflected in the final financial statement that Christy presents in December to you all. It's much easier to talk on a cash basis than on an accrual basis because it's confusing enough on a cash basis.
Yeah. Okay.
So I just, and it all kind of comes out in the wash, if you will.
Well, this year though, that could significantly be altered, right? I mean, because on a cash basis,
if you pull July and August into 2020, which would have been May and June's sales, and then we start to recover, 2021 could be a whole lot different, and 2020 could cool down.
Yeah, I mean, because our cash basis collections are going to look better than our accrual basis collections once we actually get May and June in.
Correct. Right. But the numbers that we report every month, that the finance reports and that we do the press release on, is really based on our cash that we receive at that point. So it's the astute reader that understands that we do make those modifications when we do that financial statement.
So you mentioned the money we've just gotten in for February collections, correct? February sales.
Correct.
And how much is that up? That was up over.
It was a little over 400,000 over last year, February.
Okay.
465,000.
So,
but again, we had an extra day in February.
Sure.
Extra sales day. And it is, go ahead.
I was going to say, the unfortunate timing of all this, I mean, our last few months had been trending up from a sales tax collection standpoint, which I guess is good, but we were on the right track, improving from a sales tax collection standpoint, and it's unfortunate that we
for the first time since 2014.
Yeah.
Correct.
I mean, because we just posted January's numbers, which were up 11% total from sales and use tax standpoint. So I mean,
it is unfortunate. When I look at percentages left, we had about 21% left in sales tax that we needed to collect cash-wise over the next 2 months. So that's very encouraging. Through March, we should have had about 25% left because we're 3/4 of the way through the year. So you know, it is challenging.
It is what it is. Okay. Again, thank you all for the work and for the information on the financials. It is, we're going to continue to have to talk a lot about this going forward as we get more and more info about what's happening. As Councilor Gillespie said, we're certainly confident in you all's ability to keep us up to date and help us make good decisions based on real financial data and good assumptions and all that sort of stuff. So thank you so much.
One thing I might mention, Mayor, and you all be thinking about, how can we best present this to you as we go through the next few months, and don't want to overwhelm you with facts, but and again, don't need an answer this evening, but be thinking about how that might best look to you.
I was thinking about this earlier, just in the sense that one of the things that is going to be helpful for us going forward as we start to get real numbers and see exactly how much we're down, somewhat of a priority list of, what can be cut first, what can't be cut, what we feel like we should spend reserves on to save, and what we feel like, we're better off. There's at some point, there's going to have to be decisions like, do we spend reserve money to keep this thing going, or do we just say we're going to have to shut that down for now and not use reserve money on it, right? So, we're going to have to kind of have a priority list of, where do we cut first, and where do we cut last, and which of those things should be propped with reserves, and which of them should be constricted before they're actually just shut down altogether. So kind of getting a list of some kind, or at least a roadmap of where we see that coming would be a good thing for future discussion.
Okay.
I saw a really neat tool the other day on this, Melissa, that was kind of a triage approach to it's kind of a decision grid. That was it was a really neat thing about things that can be kind of deferred, things that are, that must stay the same, things that will look different. I looked at it from several different views, but it was very simplified. I think I'll send it to you. It could be an effective way to maybe share information. I think this is also information that's not just important for us, but it's important for the community to see, I think, how those decisions are being made and how we're making, establishing priorities, what is maybe just paused and what actually is just changed, and all of those things.
Christy and I had actually started a document last week where we were listing out what would be those, what are criteria, and the first one that came to my mind is federal funding available. So is that one-time funding source available? That kind of helps differentiate between, but going through and saying this is statutory, we have to have this, or this is per charter, we have to have this, and making those buckets, creating those buckets is going to be essential as we move through. I would love to see what you found.
You hear us talk frequently about core services. And those core services are going to be at the top of the list. You can't live without water. You also need, in combination with that, wastewater, electric, and then all of your safety issues, both police and fire and emergency management. And then we need people to maintain all of that. So those are certainly the things will be at the top of the list.
Yeah, I know this is it becomes really difficult because the city, you all and the city in general have, given the financial, troubles that Melissa described from a few years back when the oil markets dropped as much as they did, we've already trimmed, most of the non-essential stuff out of the city and the city budget, and so there's not exactly people just hanging around not doing anything, right? There is a lot of there's not a lot of fat to be cut already.
Right. In 2014, we had over 630, I think, employees. Right now, we average about 530. So that's a pretty good chunk of change just in of itself.
Yep. All right. Well, we'll make those decisions as we have to, right? So we appreciate the input. Anything further on the economic agenda item, counselors? So we'll jump down to item 3B, which is just an update on COVID-19. I'll start this off by just kind of reiterating what we did at the end of last week. I amended our emergency order to extend it out to April 30th, which really just kind of keeps it in line with the current state order by the governor, and also in line with federal CDC guidance on what those dates should be. So our stay-at-home order and all of our business closures and all of those other restrictions that have been in place for the last few weeks will be extended out through April 30th. Again, subject to potentially further extension, or if recommended and if warranted, shorter. But we'll play that by ear as we go forward. The shelter-in-place order again is a requirement that you stay at home unless you have an essential job to go work at or an essential errand to go run, like picking up food, picking up medicine, taking care of a loved one, essential exercise. I think that's people ask, where do you see the issues, or where do you see, places where we need to improve? I think that's really the big one, is just people choosing to limit their non-essential trips. I think we're still, seeing a lot of folks who probably don't need to be out at the store, who are out there anyway, and that's really, I think, where we can do the most to limit person-to-person contact, which is how this disease spreads. I was on the radio this morning, and the way it kind of came up, just talking about the fact that it is clear. I was on a call. Actually, the vice mayor and I were on a call last week with the CDC director, the former CDC director, who was talking about research that shows unchecked COVID-19, someone with the coronavirus could be expected to pass it to 5 other people if we were not practicing social distancing, which would make it 2 or 3 times more infectious than the flu. And you can have it and not know it, and you can spread it without having symptoms. That's why it's so infectious, because people can have it, and if you know you have the flu and you're sneezing and coughing, or you got a fever or whatever, to not go around other people. But you can have this disease and not realize you have it and spread it to other people. And so my question for all of us would be whether it's worth whatever that trip is, whatever that reason is to get out and go interact with other people. Is that worth unintentionally making somebody else sick? If you were to find out afterwards that you had the disease and you gave it to somebody, and that person ended up very sick or potentially even dying from it, would the reason that you were out have warranted the effect of you being out? And that's I think a fairly sobering question for all of us to say, is it really worth it? I mean, if we were to make somebody sick, am I out here for a good reason? So please stay home unless you have a necessity to get out for. The second part of the order was a strong recommendation to, if you are out on an essential errand, to wear a cloth covering over your mouth and nose. That's again a recommendation from the CDC. I talked with staff about whether we want to make that mandatory at this point, as some places have done. I think it's difficult for us to make that mandatory, given that the city is currently asking for donations of masks. There's still a shortage of these resources out there, and so it's difficult for us to tell everybody that you have to, given that we don't necessarily all have them. I say that also noting that the CDC has given recommendations that really you can wear a scarf, you can wear a t-shirt that you wrap around your mouth and nose, or some other. It does not have to be a surgical mask. In fact, if you have medical quality masks, we'd appreciate it if you donated those to the hospital and wore a homemade or a cloth mask of some kind for yourself. But just something that covers your mouth and nose, again, not to keep you from getting sick while you're out, but to keep, in case you have it and you don't know, to help keep you from spreading that virus to somebody else. So at this point, that's a strong recommendation. You should be wearing a mask while you're out. If you are operating a business and your workers are interacting with the public, they should be wearing masks while they're interacting with people. I anticipate that we will see this as a mandatory requirement going forward as the supplies become more available. As we talk about coming out of this and opening things back up in stages and that sort of thing, I fully expect that CDC recommendations and government recommendations are going to be that, as things are back open, that there will be a requirement to wear masks in these public settings. So you should be planning for that, trying to find those as you can, and using those masks at any time when you're potentially interacting with people in public. The third part of the order from Friday was just an allowance for our Planning Commission and our Board of Adjustment to meet by this kind of remote setting. We're still working on making sure we've got all those details in place to allow that. But as we've talked about with the ordinance that we passed a while back, to make sure we're still letting projects move forward, we want to make sure that the business of the city is still being able to be handled. So past order had said all of those meetings would be canceled, so we opened that back up for Planning Commission and Board of Adjustment as we get their online meeting capabilities set up to make sure that we're not slowing down projects that could still be going forward. So that's where we are from an emergency order standpoint. I think from a number standpoint, just looking at today's numbers in Oklahoma, we passed 2,000 person confirmed case mark, and we're up to 99 deaths statewide. I think those numbers are good in the sense that they're not good at all, but we are not seeing the sort of explosive growth that we would have been seeing if we hadn't taken these actions. So it's good news in the sense that I think our distancing measures across the state are working. We're seeing the curve peak slower and later, which is a good thing because it's allowing our hospitals and our medical professionals to catch up and to be ready when these cases do come in. But this is not anywhere close to over. We're still in the middle of this pandemic, and it's more necessary than ever to make sure that we're continuing to slow the spread of the disease by using the physical distancing measures that we've set up. That's sort of the current status. Counselors, any comments or questions or thoughts about sort of where we are?
Well, Mayor, I think kind of going back to our previous discussion on item A, we've been looking at this very closely. With the numbers being what they are, is kind of reassuring in the respect that it certainly could be worse. But one of the things that I think we need to guard against, and one of the things that we need to make very clear, is that we want to reopen business. We want to restart this economy as soon as we can, from a responsible standpoint. But one of the things we need to guard against is looking at getting back into things too quickly, because the possibility of rebound of these numbers is very real. So we've gotten a lot of emails this week. I'm sure I'm not the only one, about when we're going to lift these restrictions, when we're going to let people get back to work. And honestly, I don't know that any of us have a good answer to that right now. And what I've been telling people is that these are things that we look at constantly. These are things that change certainly every few days, if not by the day or by the hour. And so I want to reassure everybody out there, I'm a small business owner myself. Times are hard right now. But one of the things that I think we need to guard against is trying to reopen things too quickly. And so I just want to reassure everybody that these are things that we look at constantly, on how best to answer these questions. And fortunately, right now, with our order extended to April 30th, we have the luxury of a couple of weeks to gather more data. But it's pertinent that we don't rush into reopening things too quickly. Because like I said, if we do that and we rebound on these numbers, everything we've done up to this point has been all for naught. So I think that's something that we need to keep into perspective, as difficult as that is, especially from a business standpoint. It's the responsible thing to do. So.
Yeah, absolutely. I agree. You know, it is a difficult calculus to kind of play out for all of us to figure out when is it time. And I think there were a few factors that go into that. We've been, you know, I think all, like you said, we're all kind of reading these things and sort of trying to figure out what is it going to take? What do we have to see? Where you know, where does the curve have to be? You know, some of the things I see in those discussions are the availability of testing, where we have more testing available, but it still takes a long time to get results back. It's still not open to. I saw the governor today saying, "Hey, we've got this availability, but it still requires that you were in contact with somebody who had it, or you've got all the symptoms." Right. And as we've just been saying, and what we've seen from medical professionals and the research is that you don't even really have to have symptoms to be spreading it. So if we're only testing people that have symptoms, then there are people out there spreading the disease that haven't been tested. And until we have a broader availability of that testing and we can give it on a much broader basis and get results much more quickly, because right now we're seeing still 3 to 5 days sometimes on a turnaround for whether you have the disease or not. So that's going to be one of the factors that we're looking at in terms of when can we start reopening things, is when we feel like we have a much better handle on identifying who has the disease and who doesn't. Another factor that I think we'll be looking at, again, is our hospital capacity numbers. Those continue, I think, statewide to be in decent shape. We've gotten that. The governor's worked hard and the federal government have worked hard to make sure the availability of PPE is better. I think right now, according to the latest executive report on the Department of Health website, we have almost 12 days average statewide of PPE in stock. That's better. I know in Stillwater we were down to 3 or 4, a couple of weeks ago, and so we have pushed this so that we're a little bit better prepared. But keeping an eye on how many beds are available and what our PPE stocks look like, and making sure we feel like even if there is a spike, it's not going to be so big that it overwhelms. That's going to be a big piece of figuring out when we can reopen. And there are other factors that go into what the epidemiologists and the public health professors are telling us, professionals are telling us. And like you said, Councillor Wedlake, I think I want people to understand that this is not something that we just do and don't think about again, right? I mean, all of us are consumed from a staff and a council standpoint with these issues all day, every day. And, waiting to hear from somebody that says, okay, now it's time, let's start talking about it. We will act as quickly as we can, because as we just talked about for almost an hour, this is a tremendous financial difficulty for the city as well, right? Nobody is out there right now saying, oh, this isn't that big of a deal for us, so I don't really care, right? I mean, everybody is being hurt by the situation we're in, and so there is no incentive for anybody to do anything other than try to get it open as quickly as we can, in a safe way and in a way that doesn't, like you said, undo all of this hard work by creating a bigger problem when we reopen. I would also just add that I follow our sister city in Japan, Kamioka. I follow them on Facebook, and their mayor, Japan was one of the early places where it started to pop up early this year, late last year. They did a pretty good job controlling it, have been fairly open. They're currently in the process of shutting things back down. They've got 3 new cases in Kamioka in the last week, and they're closing all their stuff back down. They're closing their gyms and their fitness centers, and they're talking about people wearing, making sure people are wearing masks and social distance. So this is not something that we are just gonna, all of a sudden be free of. It's something we're gonna have to keep working on a continual basis for the next few months at least. Other thoughts, councilors, on COVID-19, on opening back up, or status reports that you'd like to share? Okay. There is nothing else on the agenda for tonight. I would just, again, thank staff for all of their hard work in dealing with this crisis. Thank you guys on the council so much for the work you've been doing. Vice Mayor Darlington was here early in the meeting and had to step out for a meeting with one of our local health groups. She's been working tirelessly on the mental health side of this stuff in terms of what resources are available. She'll have some more info. We'll have some more info on that front here in the next day or so as well. But certainly, thank you to all the council for the work that you all have been doing. So, if there's nothing else, I will entertain a motion to adjourn the meeting.
Motion to adjourn.
Second.
We have a motion from Councilor Jaloski and a second from Councilor Zanotti. Teresa, could you call the roll?
Mayor Joyce,
Yes.
Councilor Zanotti,
Yes.
Councilor Wedlake,
Yes.
Councilor Jaloski.
Yes.
With a vote of 4-0, the city council meeting is now adjourned. Thank you all for tuning in.